Dr. Alex McRee here with Jack's Implants. Got my partner, Dr. Russell, here with us today. Today we're going to talk about zirconia and why it's the best material to make teeth out of. So you've heard of a bunch of different materials, acrylics, nanoceramics, even titanium to make certain parts of the teeth. But he's going to go over and kind of show you, as the head of our lab and the person who oversees everything we do here, on why zirconia is the best. So kind of lead us in, like, why do you like zirconia and what's best for the patient?
Yeah, so we've got a zirconia arch here. In our opinion, zirconia is one of the best materials that you can use for these types of restorations. It is the strongest and hardest dental ceramic that we have available to use. And so with that strength, we don't have to worry about having things fracture, and we can guarantee that longevity for you. Just to kind of compare it to something, it has about 10 times the strength of a traditional acrylic over titanium bar, an old school type of hybrid prosthesis.
So when you're talking about acrylic, that would be more like, I've always said, like Tupperware, whereas this is more like glass?
Yeah, so the comparison we always like to make is plastic Tupperware versus glass Tupperware. And so, if you've ever done something like putting your spaghetti in a plastic Tupperware, you come back and what is it? It's just red everywhere. It's stained, and it doesn't matter how many times you wash it, you can't get it out of there. And so we kind of compare that to a temporary or an acrylic type material. It's gonna stain, it's more porous, it's gonna crack over time just like your old Tupperware might, versus zirconia being like your nice Pyrex, your glass Tupperware. So you can put anything you want into that, even if you get some stain on there, it rinses right off. It's the same way with the zirconia. If you drink red wine, you drink coffee, tea, whatever, it doesn't matter. The color that these go in, it's the same color they're going to be years down the road.
And I want to put out one more thing. He said porous, and that's a big word I want to hold on to. So some of the older style materials are a little bit more porous and attract stain. What it also attracts is bacteria. And so they do not smell very good when you take them off, and that's not very good against their tissue. So the underside, they call that the intaglio, what goes up against the tissue, is highly, highly polished like glass. And so there's actually studies that show that that actually adheres to gum tissue.
Yeah, and so zirconia is the friendliest material we have to your gum tissue. And so what we do in the lab is we just hyper polish this, where we get this mirror-like reflective finish. If you run your finger, your tongue over it, it's super slick. It almost feels slippery. And so what that does, it keeps plaque and bacteria from being able to adhere to it and stick next to your gum tissue where it causes inflammation. And then we also can get some slight attachment from your gum tissue to the prosthetic, which actually forms a really nice seal and keeps your gum tissue really healthy long term. What we've actually seen sometimes if we were to take these off is it almost suction cups down onto your gum tissue. It's so well adhered to it.
So that's kind of why you would go zirconia over any other material. Even if you're not coming to us in Jacksonville, I highly, highly advise going with dental zirconia.